Okay, I think technically I can say good afternoon. My name is David Campos. I'm the lead public information officer for the County of Santa Clara's Emergency Operations Center. Thank you for being here today, and we are actually live on Facebook Live as well. And we're here to launch the opening of a very important place in the county's response to the COVID-19 pandemic. You're going to hear first from our health officer, who will provide some context of why this large-scale testing facility is so critical to the county's efforts. You're also going to hear from the testing officer for COVID-19, who's going to talk about where we are in terms of testing having been prioritized. And then you're going to hear from Dr. Tong, who has been the person in charge for putting this operation together. She and her team have done an incredible job, and by the time this is done, this is going to be the largest testing facility anywhere in the Bay Area. So let me begin by calling on our health officer, and I want to note that because of where the cameras are, we're going to leave our facial coverings on to protect everyone. So with that, I will turn it over to our public health officer, Dr. Sarah Cody. Dr. Cody.
Hello everyone, welcome to a very hot day here at the Fairgrounds. This is enormously exciting and enormously important that the County of Santa Clara is standing up one of the largest testing operations in the area starting today. And not only will we be providing COVID tests, but we anticipate that in the future we'll also be able to provide flu shots, which are going to be incredibly important for protecting all of us this fall and winter, as well as our dream of having a COVID vaccine. This is a place where we could do that too. So why is this so important? I want to tell you, we are 6 months into fighting COVID. We started here as really ground zero for COVID in the United States, and 6 months in, we're still fighting. And the reason that we are still fighting is we have not had the tools to get us out. One of the most important tools to get us out is testing. Testing, testing, testing. So we invite everyone who needs a test, either because you have symptoms, because you've been in contact with someone, or because you're doing activities that you think might put you at risk. Come here and get tested. If you test positive, before you hear from anyone, the minute you know you're positive, you isolate yourself away from others. Isolate yourself away from others. And get out in front and let those people know who you've been in contact with that they also need to isolate themselves from others. That is the way we are going to get out of this. Get tested, know your status, and take action. Spread the word to families and friends and coworkers to do the same. That is how we are going to get out of this. That is how we are going to get our businesses back to work. And that is how we are going to get our kids back in school and learning. It's testing, all right? So we have made it available at scale, mass testing. So come on over, get your test, and let's get our lives back. Thank you.
I want to note that Dr. Cody and I are wearing our census masks, face coverings, because even as we have this pandemic, we're still in the middle of the census. We actually have until the end of September, and there are about 30% of the population in the County of Santa Clara that has not responded to the census, so we want to highlight the importance of that. You know, there's something about having the right person at the right time. Having Dr. Sarah Cody as the health officer has been really critical to the success and the ability of the county to respond. And the next individual, having him in the role of being the testing officer for COVID-19 for the county, has been really instrumental in ramping up the testing. So with that, I'm going to turn it over to Dr. Marty Fensterscheib, the testing officer for the County of Santa Clara.
Thank you, David. So I'm really excited to be here today. We've come a long way in our county in increasing our testing, and I'm very proud of Valley Medical Center and the county for being able to set this up. At this point, the county is doing about 40% of all the testing in the entire county at this point. And with this new site, we're going to again increase the amount of testing. So as was mentioned, we're doing more testing at this site as a mass site than anywhere in Northern California. And as it's been said, we want people to come down here that are, unlike our other sites, our pop-up sites, where we basically said asymptomatic people because we had people in line walking up. This site is a drive-through site for now. It will be expanded, but right now, for the most part, it's drive-through. And so if you have symptoms, you can come to this site, stay in your car, and get the fast, simple, and free test. It's just a swab. They will put the swab into each side of your nose and hold it for 10 seconds, and that's all it is. It doesn't hurt, it's easy, and it's free. You don't need any medical insurance. You do need to go online to our website and make an appointment for this test. We also are very excited that we will have the availability for people that don't have cars to come up and walk through a gate where you don't need a car, but you still have to make an appointment at this point. Down the road, we will see how we do, and hopefully we'll have just people that don't have appointments. But right now, you need the appointment. We also have a bike lane. So in order to stay green and have people on their bicycles come up and get a test also, but again, you have to be registered in order to do that. So again, if you have symptoms, if you've been a contact, or especially, as Dr. Cody mentioned, if you are a frontline worker, those people who we appreciate in our lives that every day are working to stock our grocery shelves, to ride our buses, and to work to keep people working at restaurants and others that are frontline to the community, we want you to be tested. On a regular basis, one time is not enough. We want you to test at least once a month. So again, you can see the cars are already coming in and people will be tested in this site. Down the road, we plan either in this site or across in the Fairgrounds to have the availability of flu vaccine. And I want to just preface, because I have the opportunity now, to basically say that this fall we have got to vaccinate everybody for flu. We will get confused as to whether you have influenza or COVID. So in order to protect everyone from flu, let's get rid of flu as a disease in our community and test and basically vaccinate everybody. So 6 months on up, get your vaccine, go to your health provider to get it, or when we have it here, you'll be able to get it here. Okay, thank you.
As you can imagine, there are many challenges that come with putting together the operation to run a facility on this scale. We are grateful to the Valley Medical Center for making that possible, and the individual who has actually seen that very complicated operation and who has demonstrated an ability to just make things happen is Dr. Jennifer Tong. So Dr. Tong.
Doctor is Jennifer, what's the first name?
Yes, hi, it's Dr. Jennifer Tong. I'm the Associate Chief Medical Officer for Santa Clara Valley Medical Center. And since the springtime, Valley Medical Center has been increasing the amount of testing that they've made available for our community. We continue to have multiple pop-up sites throughout the county, as well as mobile teams that go to places in most need, and we will continue having those. One of the reasons we decided to open the drive-through site was to have better options for people who are having symptoms. For those with symptoms, the most important thing is to call your physician, who should be able to test you and evaluate for any other causes of symptoms. However, if you don't have a physician or if your physician is unable to test you, we remain available. In addition, this site is well designed for people who are at higher risk and might feel more comfortable being tested from their car. And we designed the site to be convenient for those who work so that they can make an appointment and have a scheduled time. The total period from the time they drive in to the time they drive out really should be less than 15 minutes if they're there at their appointed time. This has been a collaboration from multiple parts of the county. All of our testing has been a collaboration of multiple parts of the county. We've already been testing about 2,000 to 3,000 people per day, and this site will give us a capacity for at least 1,000 more. It was designed to be able to scale beyond that 3 to 5 times. We've had people here from our parks department who are helping with traffic control. We've had people here from our facilities department helping with the portable temporary buildings. We've had people here from our technical services department helping with the IT setup. We've had roads and airports helping not only with the surfacing but also with traffic engineering. And our entire clinical team is provided by Valley Medical Center. So this is the best example I can think of your local government working effectively for you to keep you safe. Thanks.
Thank you, Dr. Tong, and again, thank you to your incredible team for making this possible. You know, from the beginning of the pandemic, our Board of Supervisors has made it clear that testing has to be a top priority for the county, that's critical to the response. So to represent our Board of Supervisors is our President of the Board of Supervisors, President Cindy Chavez.
Well, good afternoon, everyone. And I want to start by saying a big thank you to the Fairgrounds Management Corporation, and in particular to our leaders over there and Abe Andrade. This had to be done fast, and they did it. Now, why are we moving at breakneck speed? Here are the numbers. We are getting 275 new cases on average a day. We are close to 15,000 cases in Santa Clara County. We're hospitalizing on average 175 human beings, our fellow members of our community, a day. We had 4 new deaths just today, with a total of 213,000 deaths in total. This is a lot of anguish and a lot of grief, and all of it preventable. How is it preventable? If you need a test, you can go to sccfreetest.org and find a place to get a test. If you are positive, isolate. If you are, quarantine. If you're not sure, isolate until you get the test and the information that you need. This is particularly important in communities of color. Our Latinx community is seeing skyrocketing cases. While we're seeing some steadying in different parts of our county, in the east side, we're seeing a continual increase. Young people, if you're 18 to 40, you are not immune. And this is important because an 18-year-old or any young adult that's going back to visit their family, you could be visiting your family and visiting upon them illness and maybe death. What this requires is us as a community to work together and to do it in the most bullish fashion we can. And the reason is that the solution to this crisis is in our hands. There's no cavalry, it's us. We're the people we've been waiting for. Wear your masks, don't touch your face, wash your hands and socially distance, and we can beat this back. If we don't act, we could see a whole nother year of children not in school. We could see a whole nother year of mental health issues. We could see a whole nother year of economic devastation. I cannot emphasize enough how important it is that the county continue to play a leadership role, that our fellow healthcare providers play a leadership role, and that each of you play a leadership role in getting our communities back. Thank you.
Thank you, President Chavez. And we do want to note that the number of deaths is 213. At this point, we're going to take any questions that you have for our speakers. And after the questions, we're going to have a bit of a demonstration of how the drive-through works for bicycles. So how it works if you're on your bicycle. But any questions for any of our speakers? Yes, Chris.
For Dr. Fenstersheim?
Okay, for Dr. Fenstersheim.
Marty, can you tell us at this location, when people get tested, how long will it be before they get their test results?
So the question was, what about the turnaround time for tests? Everything is going to a lab that has been able to turn around tests very quickly, so we're looking at 3 days on average.
3 days?
So that's fast.
Okay.
It could be shorter, it could be a little longer, but that's pretty much it. And that's a good amount of time for turnaround. That's a good acceptable amount of time.
Okay, Chris.
Marty, question for you as well, just to follow up to Marianne's question. How many tests are you processing per day? And in terms of overall lab capacity for the county, where are we at right now when you also account for labs in addition to the ones that the county is working with to process tests?
So there are a lot of labs around that do processing of these tests. And Valley Medical Center up until now has basically used their own lab, and we've also used the public health laboratory. And we've been able to do within the county, as I mentioned, 40% of all the tests, and we're averaging about 6,000 tests a day. We have now contracted with another lab in Southern California to help us so that we can get this site, which is now probably at 500 today, 1,000 by the end of the week, and 5,000 down the road a little bit. So we will be able to use a number of labs with good turnaround times in order to process our specimens.
Marty, can you talk a little bit more about the potential for how bad it could get with the flu season that's coming and why that's so important for people to get the flu shot?
Yeah, how bad it could it get with the flu? And I can only talk from my knowledge and doing this for a long time also. But typically, in the fall, we see a lot of influenza along with other respiratory illnesses. And COVID symptoms include fever and shortness of breath and cough. And so those symptoms, as you know, are very similar to flu and other respiratory illnesses. So we want to be able to differentiate between those illnesses. And one way of doing that is eliminating the possibility of flu by doing the vaccination. So it's just going to get more difficult as fall comes in. And so we want to try to be one step ahead, basically, of diagnostic capability.
Marty, we talked about the digital divide, but some families don't have access to computers, and it's difficult for them to make an appointment online, also with language barriers. Can you address why they have to have an appointment online? And you mentioned that might change.
Yeah, and not all our pop-up, as Dr. Tong would tell you, our pop-up sites don't require any online reservations. So those are still available. Still go on our website and find one of those sites if you don't have access. We will eventually, as soon as we can get this running smoothly, look at the possibilities again of having walk-ups without. This allows us to do a lot more testing faster because we don't have to wait and do all of the registration. So we can bring in 5,000 people into something where you have all the paperwork done ahead of time. But there are the availability of those tests for people that don't have access. And also people, don't forget, you have your own providers that are required to do testing for you if you fit in those categories.
Any other questions?
Yes, for Dr. Tong.
Dr. Tong, yes.
Dr. Tong, what is the cost of this entire operation, and what are the numbers as far as staffing? Also, will it be staffed 7 days a week?
So currently our staffing is for 5 days a week, Tuesday through Saturday. We have selected later hours so that we are open and have appointments available for those who need to come after work. On Saturdays we'll be open during the daytime hours. We have approximately 15 clinical staff here today to start, and we'll be adjusting that as time goes on to increase our throughput and capacity. We also have approximately 10 disaster service workers from other parts of the county employees who have been asked to come and do this work instead of their normal work. We are still factoring how much the total cost is. It will depend on the number of tests that we scale up to do.
If you would like to tape the bike through testing, there's a young lady in blue over there who will allow you, will guide you on where to place the cameras. Thank you.
Oh, will you be speaking in Spanish later, or?
I'm happy to.
Okay, can we do that after?
Yeah.
Thanks.
Over there.